We're delighted as the Welsh Ambulance Service to be working with ABMU and Welsh Government colleagues to introduce this 111 service on a pilot basis in ABMU now and then in Twickenham later on. We've worked very hard in our preparation to launch the service, but we will also be learning and working from this pilot to ensure any lessons that we need to learn we will take on board with the view to being able to provide this 111 service for every member of the population throughout the whole of Wales.
When it's an emergency, patients know how to access our services. However, when it's not an emergency and it's urgent, where do you go? Because there's a range of options that are available to patients. Some of that could be going to see their local GP, some of it could be a pharmacist, community services, could be out of hours GP, it could even be contacting NHS Direct. So there's a range of options there. However, when it's urgent, often you go to the easiest point of access. Sometimes that will be your emergency department, rightly or wrongly. What we're trying to do with 111 is put an umbrella over some of that to try to simplify some of those points of access. So if it's urgent, call 111. There will be an experienced and trained call handler who will take your call and will be able to direct you to that most appropriate service. And we'll have trained nurses and potentially some GPs or pharmacists there who can give you that advice in a timely manner. If you've still got chest pain, clearly you'll need access to 999 services. The 111 team will direct you straight away through. An ambulance will be dispatched, and actually if you need to go to our A&E department, that will still happen in the normal way. If you need to access GP out of hours services in the same way that you do currently, actually you will go through via that line and you will be able to access GP out of hours services.
As part of the 111 pilot, the ABMU GP out of hours service has been working to make sure that our patients get the right care with the right priority in the right place and by the right professional. This has been quite challenging in a time of increasing workload for a GP out of hours service, which has not just been led by GPs but traditionally also been delivered by GPs. It's therefore been fantastic to work with professional colleagues such as pharmacists and nurses to ensure that our patients get the care and the help that they need as efficiently as possible.
There's going to be many benefits to the patient, there's no question about that. The experience and the quality that we'll be able to offer will be far better than it's been up until this point in time. However, we all know that there are a number of hard-pressed services within the NHS currently. 999 ambulances are under a lot of pressure, equally so are our emergency departments. We also know that quite a few of the cases that end up going to emergency departments could actually be cared and managed in a more effective way.
There are a proportion of patients who come to the emergency department with problems that really aren't within our sphere of expertise, and some of them get told that and they don't like that and they've waited a long time to be told that. Whereas if they access the 111 service, then hopefully they will be directed to, for example, the out-of-hours primary care service, which some people still don't know exists, and actually at weekends and on bank holidays they come to the emergency department because they think it's the only place. By accessing 111 first, they will know about the alternatives that will provide them with better care in a more timely fashion.
This is going to be a service that is unique to Wales and the Welsh population. We've looked at some of the best practice both locally, nationally and internationally. Places like Scotland, NHS 24, they've had similar services up and running for the last 2 to 3 years and have had some really good outcomes associated with it. Equally now, you look at places like Australia, New Zealand, Canada, all of them are moving in this general direction. All of them are looking at simplifying access into urgent care services, and this is exactly what we're trying to do in Wales. Keep it simple, keep it straightforward, make sure that you get the right services at the right time.